Hi, and welcome to Digital Unplugged. My name is Ed Marks. I serve as the Chief Digital Officer for Tech Mahindra Health and Life Sciences and HCI Group. Excited, as always, to talk about digital, and especially this particular series on Digital Unplugged, and our guest that has been with us many times, Patty. And so we'll do quick intros and jump right in, but we do want to remind everyone this is live. Obviously, it's recorded and other people won't get it live, but for those of you in our live audience, we do it live for two reasons. One is to interact with you, so please ask your questions, and you know how to do that, and I'll be looking at various questions. We already had 3 questions come in previous to today, and so we'll try to get to all the questions for sure. Here you can see our background, and again, Patty's been with us. I think on the next slide, you'll see sort of the webinars that we've had since January on this same topic. And really, in all of it, we were alluding to our book that Patty and I had the opportunity to collaborate on. And so we're really excited to share with you some of the insights. So that's really what part 6 is all about, is sharing with you some of the insights on the book. We're not here to sell a book, so don't get the wrong impression. We're actually going to be sharing with you some of the content from that book that we've collected and wrote about, and I think you'll find it very helpful. So with that, we're going to get into a few key takeaways so you know where we're headed on the next slide. And we're gonna have a few minutes to spend on it, and this was some how we define digital. Again, the thing here was use any definition that you want. As long as your whole organization agrees on a definition, then go with it. There's no magic behind the definition. Just pick something and move on. So on the next slide should be our key takeaways. So there's some of the things we're going to try and cover in 28 minutes, which we will do because we're not going to read slides to you. You'll have access to the slides and obviously the webinar recording, but we'll probably pick one thing from each slide just to highlight. But this is like giving you some of the keen insights into the book and what was discovered. So you can read it here. I'm not going to read it to you. And with that, Patty, any opening comments before we jump right in?
Well, you know, we're all living through a very, very interesting time as it relates to how the pandemic has impacted technology spend, impacted the pace of digital transformation, impacted the priorities. And so every passing week or month seems to provide us some new insights on what is going on in the market. And hopefully we can share some of that in this conversation.
Yeah, and that was a nice thing about the timing of the book. So we had envisioned the book in the fall of 2019, and then we wrote it through January. We were getting ready to go to press, but we realized what was happening with the pandemic. So we purposely pulled the book off the press and then spent another couple months just making sure that we addressed things that would come from not just this pandemic, but in future ones as well. So it is a timely book, but it also passes the test of what's happening here now, because it's really foundational and future all together in one continuum. So with that, let's jump into the first thing. Probably 15 seconds here. This is just the model. So the model there is a model in the book. This is the next level of that model as it continues to evolve. But really the key point here, and we're going to move to the next slide, is that digital transformation is about the experience. So always have the experience at the center. So next, we're going to talk about digital maturity in health systems. Patty, I know a lot of this is your empirical research. Please give us one key point out of the digital maturity.
Yeah, so the maturity model, as you can see, it goes from 1 through 4, and enterprises that are in model 4 are what we consider to be at a very high level of maturity in terms of their digital transformation roadmaps and the progress they've made, and they are the ones that have comprehensive, documented enterprise digital strategies. And Ed, you and I worked on that, worked on something like that when you were at the Cleveland Clinic. And they also look at digital transformation not from a limited perspective in terms of either telehealth or digital front door, but also look at all the back-end IT transformation that needs to happen in order to enable the digital experiences of the future. The reality of the healthcare market is that if you look at the 5,500 hospitals or so that form part of the healthcare landscape today, over half of them, I would say even a majority of them are in Model 1, which is really looking at their electronic health record platform as the system of record, but also as the system of record for digital transformation. And so what that means is enterprises that have these EHR systems are saying, whatever is available in EHR, we're going to roll it out. That's going to be our digital strategy. But that can be very limited. And a lot of health systems are moving towards Model 2 now, which is where they look at best-in-class functionalities that may not necessarily be part of the EHR platform, but are available through this emerging ecosystem of health tech innovators and big technology firms and specialized companies. And they're taking all those functionalities and platforms, integrating them into the EHR interfaces and creating brand new experiences that are superior to what you can get simply by going with one single platform. So that, I think, is a significant shift that we need to make a note of as far as the post-pandemic era is concerned.
And that's what's great about the book. It's very practical in terms of, okay, here's a model. So you can take that model and improve on it, make it specific to your organization, but it gives you a good foundation. Then you can kind of see where you are. You need to know where you are in order to progress to the future. So the digital maturity model, again, you can pick a different one that might be out there. Here's a good one based on research. And then you can figure out, you can say, look, we're at level 1. We want to get to 4. Here's our plan. Here's our steps. So very practical. So on the next slide, another one of our key takeaways. So what are the top priorities for digital health and virtual care? And again, this is based on empirical research, as well as, in my role, Patty's role as well, I get the opportunity to speak to dozens and dozens of CEOs. In fact, I was with a top 15 CEOs earlier this week, and really validates what you're seeing here. So what is one, Patty, that you might highlight that you're seeing as a top priority in digital health and virtual care?
Yeah, so that's the obvious priority in the wake of the pandemic, at least, was to be able to do virtual consults because people were not coming into the hospitals, and there's a lot of restrictions even today about getting in-person care. And so that one is kind of a no-brainer, if you will, because that was obviously going to happen. But what has happened in the wake of that is that digital patient engagement is now a high priority for healthcare. It was coming along in the last couple of years. I think there was a lot of investment being made, but it was coming along in a gradual fashion. What the pandemic has done is kind of accelerated that shift towards providing improved digital experiences for patients, especially in light of the fact that a lot of healthcare delivery is now shifting to a virtual care model, telehealth, remote monitoring, and so on and so forth. So that, I would say, is what is driving some investment and focus today in health systems. The need to engage better with patients digitally and provide them with better online experiences.
Yeah, and it has been very interesting just to watch this, as this relates to one of the questions that came in. And it really is about, did we hit the high watermark? How far back are we going to retreat? There was some great work done recently. Give credit to the Chartis Group for doing this research. Again, evidence-based empirical research. And then we also did some focus groups with CIOs. So all of this is pretty within a margin of error of, let's just say, 5%. But the average health system was way less than 1%, but rounding up, we'll say 1% virtual visits. All outpatient, the percentage of outpatient visits that were virtual is 1% less. And then because of the pandemic in March, April, and maybe hitting the high watermark late April, May, somewhat as high as 80%, but really the average seems to be right around 65, maybe 70%. So what has happened since then? What's happened since then is it's gone down to 20, which was shocking to me, actually. I thought that we would normalize closer to 50. That's part of my uber optimism about digital in healthcare. But we went quite a bit lower than that. It was sort of disappointing in some respects. And then, I'll be curious now with RPM. So you mentioned, remote patient monitoring. That was starting to go higher on the trajectory as well. And I just wonder where that might level off. But those are still some high priorities.
Yeah, I think remote monitoring has been a high priority in the world of population health management for managing chronic conditions like diabetes and so on. But I think it's going to become front and center as it relates to just primary care because the pandemic has imposed some restrictions on how much foot traffic you can have within the hospital or the clinic, but also because I think economically it makes better sense, and the technology has also come along much
Yeah.
further than it was a couple of years ago. And so I think you're going to see it's not just chronic care and population health management anymore, but it's also a lot of primary care that's shifting to remote models.
So in some of our next slides, we're going to see like ways that you can continue to lead digital transformation in your organization so that it continues to be utilized. In terms of the agile digital transformation blueprint, we speak about this in the book as well. We're as I said, really trying to give you practical things because we're not just theory, we're not academic, although we do research and all those sort of things, but it's really born out of real world. And if you want to be, the key point here is if you want to lead digital transformation and if you want to truly transform your organization, you and whatever organization you're leading within your health system, whether it's IT or digital, if you have a digital title or what have you, need to become agile. If you look at all the other industries where there's very progressive companies that are truly transforming, they are agile companies. So you really need to adopt this agile mindset and really have this transformational like blueprint embedded in everything that you do. Otherwise, it's not going to stick. And I just wonder, Patty, maybe if that's some of the retreat, going from 80% to 20%, some of it may not have stuck. There's obviously many reasons for that. But I also sometimes wonder, is it because we didn't, along with this new capability, did we build in the appropriate agile workflows? Did we try to repave the cow paths, as we used to say with the EHR implementations, and didn't really rethink transformation from the ground up in an agile format?
Yeah, I would draw your attention to the second bullet point here, which is that digital transformation is IT enabled, not necessarily IT led. More specifically, you don't treat it as an IT project. And transformation is typically much more to do with culture, process, and the technology is almost the easy part. And so a part of the reason why we're seeing telehealth visits maybe drop back is that the experience of the telehealth visit is not conducive for all kinds of care, number one, and the experiences are not as optimal as we would like them to be. They're getting better every day, but they're not as optimal as we would like them to be. So there's a lot of unfinished business here, but the encouraging thing is that we've come a long way when it comes to virtual care and telehealth models, and we've come a long way when it comes to using technology for transforming healthcare. But there's a lot of work ahead, and that's the exciting part for us to be in this field right now.
Yeah, and if you haven't been part of Agile or understand it, there's always strength in reaching out to others, to other peers who might, other industries, embrace, new thinking. Don't try to take your same mindset and apply it to this new digital transformation world because it won't work. So you really have to reinvent yourself. You have to almost like digitally transform yourself. All right, so let's hit the next key takeaway from the book. Ensuring strong foundations. This is pretty straightforward, but Patty and I will each take a crack at giving you one thing out of this. So Patty, why don't you go first?
I'll go with data. As you know, Ed, I've kind of worked in the data space for a long time. My earlier book was also about data and how that is driving digital experiences. I think the ability to harness data, the ability to derive insights from the data, and most importantly, the ability to use those insights to drive improved experiences for patients and to drive improved healthcare outcomes is going to be front and center. So what that means from a foundation standpoint is that you have to have a really, really strong data management and data analytics infrastructure in order to be really successful with your digital initiatives.
Yeah, that's good. And we talk a lot. We already spoke about agile, getting a strong agile foundation. The whole concept of 2-week sprints, doing iterations, having product managers. I mean, it's a whole new way of thinking. Don't think if you do know something about agile, make sure it's the complete big picture, not just a very specific. Like a lot of times when we mention agile, people think application development. No, definitely there, but everything, the entire way that you operate, IT, and even the entire organization going to a team of teams type of approach. So there's so much to dig into that, but we just encourage you to do that. And the other thing is adopt best practices. So agile being one of them, but ITSM, IT service management, or ITIL as another. So make sure that you have these strong foundations, because if your IT is crumbling, you're not going to digitally transform. So you have to take a really hard look and make sure that you have 0 failures, 0 major incidents, and do whatever you need to do with best practice. Don't try to do it because that was the way it was done a generation ago, but leveraging current best practice in order to ensure that stable foundation, because then you can build credibility that you'll need, and also build strong digital transformation capabilities when you have that foundation in place. All right, so the next key takeaway. And a reminder, we're going quick because 30 minutes is a very short time, and we want to make this packed full of practical information. If you have any questions, we've already addressed one of them. If you have any questions, please be sure to write down questions, and we're happy to talk about it. I already mentioned, Patty, how in the process of writing the book, the timing was great because we were able to pause before we hit the printing press and really think about COVID, and not only COVID, but we were purposeful in thinking pandemic, because COVID-19 probably not the only one we're going to deal with in our generation. So with that in mind, we definitely want to talk a little bit about COVID and looking beyond. So any key point that you want to raise here?
I think COVID has to be seen as an opportunity as well, in addition to the current crisis that it has created from a public health standpoint. It is really an opportunity for health systems to reimagine the way they deliver care. And that is what digital transformation is all about. So call it the black swan event that has brought about a disruptive change. But disruptive change doesn't have to be seen in a negative context. It can be a great opportunity to really hit the pause button on business as usual and reimagine the way you want to run business for the future. And many health systems, not just health systems, many organizations across the board are really looking at it that way. And so, changing the frame of reference then gives you the opportunity to question and challenge how things have been done in the past, and how you've had to adapt very quickly to COVID, but then how you can turn that to your advantage for your competitive positioning and your long-term sustainability as an organization.
Yeah, I know back in May and June, there were many people, including ourselves, saying things like, hey, in 5 weeks, we've advanced 5 years, or maybe we're 8 weeks down the road. We said in 8 weeks, we advanced 8 years. And then like we already mentioned, we saw sort of a regression a little bit in terms of that advancement. But what has really come out of this, so people had to react without a plan. So people did great. I mean, it's amazing. I'm so proud of how the world has responded, and IT specifically, in standing solutions up very, very quickly. And now that things are going back a little bit, we have a little bit more time to be thorough in our planning. So I think 99%, again, this is based on our experience working in focus groups and talking with peers and whatnot, probably 99% of organizations did not have a digital plan. Probably had been talking about digital transformation, but no plan in place. And so now is the time to really get going on your planning. So you've got this great experience that you just had that was forced upon you. And now take those learnings and really put together a plan. And ideally, right, you take your enterprise strategy, the hospital health system strategy, and you think about how do you digitally enable that strategy. Now, in some cases, depending on the maturity of the organization, you might have a separate plan for digital strategy, whatever it is, or you may have 0. Whatever it is, you need to start the planning process and make sure you can take the digital maturity model that we showed earlier and say, look, do a self-analysis. We're at level 1, we want to get to level 4 in the next 3 years. just put a plan in place. And of course,
Yeah.
you gather your stakeholders. Don't do it by yourself. Patty, you already mentioned it's not an IT led, but an IT enabled. Okay, let's head for the next key takeaway. So this one is really sort of a summary slide, if you will, on getting digital transformation right. So we might, Patty, we've got a couple extra minutes to really focus on this, because this is sort of like the, hey, here's what you should do, starting tomorrow. So do you want to pick one, and then we'll talk about that a little bit, and then I'll pick a second one.
Yeah, sure. I think you already talked about the one that I like talking about, which is, put a roadmap in place. You have to make that effort. You have to invest some time and resources, and maybe take half a step back if you're already down the path of implementing multiple initiatives. It's all got to be part of one comprehensive and coherent strategy, which means that you have to take the time to think through how it all fits in light of where you want to be 3 years from now. You have to document it. You have to identify the initiatives and the investments that are going to get you there. You have to prioritize them, because you're not going to be able to do them all at one time. You're not even going to get the funding, even if you can do them all at one time. So picking the ones that you need to do now, picking the ones that can wait till phase 2, all of that put in the context of the overall enterprise strategy. That's what digital roadmaps are about. And I couldn't overemphasize that. And that is critical to success with transformation.
Yeah, so a lot of these are kind of basic, right? But because we're so busy, and I get it, you have so many things going on, crises, so busy doing other big projects and big things going on, that sometimes you aren't able to focus on the basics, and that's when you get in a little bit of conflict. So it's really important to, especially with digital transformation, to get it right and go back on these basics. So one common question I get, or pushback I get, is, hey, this all sounds great, but we can't afford it. So what I always say is, look, the CFOs love it. When we had some CFO guests on before, and they talked about this as well. If you can show, look, here's my digital transformation plan, or our digital transformation plan. This part with IT, like, how can we leverage digital to take out cost in IT? And there's studies that have shown, and I've personally seen it, but this is not a commercial, so you can Google or do your own research. But I've personally been part of engagements where, including when I was CIO, where we could automate things, whether it's RPA or some sort of other transformation movement to the cloud, those sorts of things, where you can take out 30% of your cost. And maybe if you're a really well-run organization, maybe it's just 20%, but depending on your budget, it all scales. 20% is a pretty big number. So then you reinvest, half of that, make a deal. Look, I've got some ideas here. I can take out 25% of the costs of our IT operations, or maybe even into other areas. And while service is the same or better, the experience is better. And let me take half of that. Maybe you'll get all of it, but if you can get half of it, and let's reinvest those dollars back into digital transformation for the rest of the organization. So for the clinical staff, for the patient experience. So that's another way that sometimes we lose sight of. And just having we tend to get defensive, Patty, because I'm CIO or CDO, I'm really proud of what I've developed. And I think there's no way we can take more costs out of IT. We run really efficiently. Usually there is a way to take more costs out. And so again, reach out to peers, or we talk about it a little bit in the book, whatever you need to do. There's help out there, and it's always good to do that exercise anyways. I think probably on average, I did that exercise once every 2 years on average for 20 years. So I've done it probably 10 times. And every time we found opportunity to reduce costs that then we could reinvest. So again, this is live. If you have a question, we have about 5 minutes left. Patty and I are going to pick on one more each of these, and then we'll be wrapping up. So Patty, I'll give it back to you.
So if I were to pick one more, I think one of the big challenges with executing an enterprise digital roadmap is the fragmented nature of the efforts within an organization. So typically, if you look at any health system, you've got you've got the marketing function, you've got the patient contact center, you've got IT, and you've got finance, and everybody else. It becomes very challenging to really align all of these groups in one direction as it relates to the enterprise digital transformation roadmap. So one way to do that is to consider kind of creating a digital transformation office, which has oversight and governance and oversight for all of the ongoing programs. It doesn't necessarily own the programs, but at least has governance and oversight and can make sure that all of these programs are working in lockstep and they're advancing in lockstep, so that there's no waste, there's no duplication of effort, and everything is working as planned. So that's the one thing that I would recommend when looking at digital transformation.
Yeah, that's great. And my last comment on this would be, and it's complementary to what Patty was sharing, is bring in someone onto your team from the outside that doesn't have a clue about healthcare. And ideally, though, is pretty much has good clues about consumer experience. And bring them onto your team, because we don't have a long history of doing digital transformation in healthcare. We don't have a long history about thinking of things from the consumer experience or patient-centered or human-centered sort of design. And it's good that we all pick up those skills, and we pick those up. And I know people read good books, talk to peers, look outside the industry for examples. And there's all sorts of ways that you can pick up some of those skills. But there's nothing that's going to accelerate you faster than bringing in someone from outside. So I always, on my team, didn't always succeed with it, but always tried to have one person from outside of healthcare. And it made for a much more diverse and rich team. Because I'm afraid that if you don't, your organization may. So it's better that you take the lead on it and bring in a consumer expert, a design expert, than have the organization do it for you. So that would be my one pearl of wisdom here when we talk about the digital transformation office and those sort of things, is whether or not you own some of digital transformation or own it completely, or whatever your part is. But if it's a material part, especially if you're IT, then you definitely want to bring someone on your team that has those type of skills. So that would be it. Look, we don't, I'm just gonna tell you a little bit, kind of close with the book. It is, as you've seen here, just from our little snippets, it's full of practical advice, and we're not here to sell books. We make, in case anyone ever wonders, it's similar to the recording industry. I think they make $1 back in the album vinyl days, $1 an album. You don't do it to get rich. It comes from our heart, really, of trying to see healthcare digitally transform, move faster, because we believe that at the end of the day, we're going to save more lives. So that's really a lot of the heart and the thinking behind this. So we're not pushing a book. It is a book I wish I had seen, read years ago. So we wrote it with that in mind. How can it be practical to the person that really wants to make change? So at the end of every chapter, there's a few ideas about, look, this is what you should do a retreat on. Here's 2 or 3 questions you should think about, stimulate thought. So we're not going to advertise like where you can get it. You'll figure it out. Again, we're not here to sell books, but it is available as a resource. And so, Patty, we've talked now over the last since January on digital transformation. Your insights have been keen, both from a book author, but all the research that you've done and the consulting work and how you've helped other health systems. So I just want to say thank you very much for all your insights. I learned a lot writing the book. I learned a lot working with you and listening to you, and your contributions to healthcare are invaluable. So thank you.
Thank you very much. It's very kind of you to say those words, and thank you for having me on this webinar too.
Yeah, absolutely. It's been fabulous. And I want to thank all of our guests that have joined us through this journey. Our webinars continue. This sort of finishes up this part that was related to the book since January. Thanks for being a listener and for your questions and engagement. We're sorry I didn't get to all of them, but definitely appreciate you being with us today. So thank you and have a super day.